Would you like to enhance your healthcare experience? Try using appreciative statements more. What's going on, guys? Dr. Sean here. I got a pro tip for you today. It involves using more appreciative statements. I've been enjoying the discussion we've been having on the tools and techniques that I call the language of choice. Those tools and techniques all aimed at answering the big question patients have when they're in front of us. That question being, do healthcare workers really care? Talked about open-ended questions, reflective or clarifying questions. We talked about using positive affirmations as well as summarization statements. We talked about also evoking confidence and normalization statements. We also talked about decisional balancing. And furthermore, we talked about requesting permission. Now, these are all tools, but they all work toward the same goal of answering that big question that patients have, that they're always asking all the time. We've also discussed various techniques, such as leveraging your presence, leveraging your posture, effectively listening, orienting patients, using framing statements, apologetic statements, all techniques aimed toward answering the big question and addressing that emotional concern that patients and people have whenever we are seeking services for care. But today I thought I would go over another technique that almost works all the time for patients that are in front of us, or people, quite frankly, that are in front of us in the healthcare setting, or just about any other setting that you work or live in. And that is an appreciative statement. Imagine you're walking down a hallway and two people are coming in single file almost. The first person might not even acknowledge you. They just look right past you. They walk right past you. They look in the direction they're going. And then a couple steps behind them, there's a person that acknowledges that you're there. They look at you. They give a head nod or they say good morning or something. Isn't that qualitatively different? It's as if the second person is acknowledging you by saying good morning and giving you some eye contact. And with their gesture, they're saying, I appreciate the fact that you're a human being. I'm acknowledging your value, your inherent intrinsic value associated with your humanity. So appreciation statements don't always have to be major declarations. Sometimes they can be head nods or just hello or good morning. Or sometimes we can frankly say, I appreciate you. They're very subtle sometimes, but they're also and most always very meaningful when they're sincere. So when we're talking to patients and also when we're in the people care space or in the healthcare space, appreciative statements go extremely far. I personally use appreciative statements when I'm talking to patients, and many times after I introduce myself, I'll say, welcome to our hospital. In other words, I'm saying, I'm glad you're here. We value you here. I use appreciative statements when I'm talking to my nurse colleagues. I might ask them a question about what medication was given, what dose at what time. I might ask them where the patient went if they're not in their room. When they look in their computer and give me information that involves them extending themselves to a degree, I let them know. I really appreciate their efforts to inform me as to what's going on in that space when I'm not there. When patients ask me specific questions about their test results or the implications of their test results, I want them to have clarity, so I thank them for asking those questions. I tell them I appreciate the fact that they're asking those questions because I want them to be engaged. In summary, because everyone has value intrinsically and everybody appreciates being valued, appreciative statements work almost all the time. The more you practice using appreciative statements, the more you'll realize what you're actually doing is practicing gratitude. Use appreciation statements to enjoy more success, helping your patients enjoy more success. Take care, guys.